Aging populations have increased needs for healthcare and services. And with the sheer size of the baby boom generation now moving into the older age group, state government services and budgets may become strained. Joining me now to talk about those changes is Minnesota's Commissioner of the Department of Human Services, Emily Johnson-Piper. Welcome, Commissioner.
Thank you for having me.
The state demographer spoke of the sheer size of the generation, and Minnesota has the second longest longevity in the nation. Is there a silver tsunami coming?
Well, I think the answer is yes. And I think, though, that it's not unexpected that we have been preparing for this for a long time as a state and continue to today to try and make sure that we're evolving in the way we're doing business as a state, providing services to people, anticipating that we're going to have this silver tsunami coming.
The CDC in 2013 said that 2 out of 3 older Americans will experience or do experience chronic health conditions. How can the state pay for what's coming?
Well, that's a really big challenge because we pay a little over $1 billion every year already in Medicaid funding. So just on the public health care program side for long-term care, we project by 2040 it'll be about $4 billion just based on what we know about our population. And so what we have to continue to ask ourselves is, how are we going to do things differently? How are we going to change the way we're serving people to make sure that they have that adequate support necessary, but also that they have choices and they have quality of life they want going forward as well.
Mm-hmm. One program I read about on your website was Own Your Future. Can you talk a little bit about that?
Own Your Future is a really cool campaign that we've been advancing as a state, and it really is about making sure that people are prepared for retirement and that they're planning for their future. And it started out as a public awareness campaign. A few years ago we surveyed about 10,000 people and identified that 1/3 of them didn't have any plan for long-term care. And so we have since then been really working as a state trying to develop real changes to long-term care and services, and including right now Own Your Future working on development of long-term care insurance policies for the state of Minnesota. One is a term to long-term care insurance, and then another one is a potential rider of long-term care on a supplemental Medicare supplemental policies to try and make sure more people are prepared.
So these are products that individuals can purchase to kind of help be more prepared?
These would be products that we're trying to work through so that they're available to people going forward. Yeah, that they then could purchase, hopefully, so that they have long-term care coverage moving forward as they age.
Now, anecdotally, I've heard a lot of boomers talk about how they don't want to end up in a home. How can people stay in their homes, in their communities longer and have good quality of life?
Well, it's interesting because Minnesota has an interesting history in this way. In the 80s, we were the state with the highest number of people living in nursing homes, and we put a moratorium on nursing home beds. And since then, we've really shifted into focusing on how can we help people age in place? How can we help them stay in their homes? And we have lots of programs that we try and work with individuals, including providing them services that they need to stay in their homes, and then when they enter into a nursing home, making sure that while they're still, before they spend down their assets, because it's really expensive to live in a nursing home, we focus on those people and try and get them to return to community. And so we have programs in place to help build the supports in community for seniors to make sure that if they don't want to stay in a nursing home, that there are adequate and available services in the community to help them stay in their homes as long as we can let them.
So I'm a child of baby boomers, but I haven't had that conversation yet with my parents about, their aging and what they hope for and if they're planning. And what advice do you have for children of baby boomers to kind of have this conversation with their parents? And also, what advice would you have for boomers who didn't have children or aren't sure where they might get the help that they need as they age?
Well, I think, one of the real challenges, and I have that same issue too with boomer parents, and what we know about the demographics of how many people are aging and what that silver tsunami looks like, you and I are going to be the caregiver team in part for our parents. And so we do need to start those conversations early and often, make sure that they have financial plans, that while they still have capacity, that they have advanced medical directives, that we know on the front end what they want to do, where do they want to live, how do they want to age, and having those conversations as a family, I think, is key before the changes are needed to be made to help support a person. And we also have really great resources for seniors in Minnesota. We have a senior linkage line, 333-2433, that people can contact and get all the information that they need.
So this is a
statewide senior linkage line with all sorts of resources and really great professionals ready and willing to help people.
From your point of view, though, you are encouraging people to really start looking at this now and be planning for their own futures. Is that correct?
I do, and I think we're already feeling and facing the real challenges we have as our population ages. We have workforce shortages in our long-term care, direct care treatment sector, and so we're already feeling the pressures of the age wave coming.
Commissioner Piper, thank you so much for joining me today.
Thank you.